Welcome everybody to our Missouri Open Door Benefits series. This month's topic is Older Americans Act programs. If you are new to the Missouri Open Door series, my name is Angelina Alpert. I am a research assistant at the University of Missouri, Kansas City Institute for Human Development. And just a couple of things about the series. These are recorded and posted to our YouTube channel. So if you have to hop off, this will be posted so you can go back and look at it afterwards, or if you want to share it with anybody else afterwards. The Q&A is open. Feel free to drop your questions in there as we go, and we will go ahead and get those answered for you. So this benefit series is sponsored by the Medicare Improvements for Patients and Providers Act, also called MIPA, Priorities 1, 2, and 3. Priority 1 is Missouri SHIP, which is the State Health Insurance Assistance Program. They are very much in the midst of open enrollment right now. Priority 2 is the Missouri Department of Health and Senior Services on behalf of the AAAs, and then UMKC IHD as the No Wrong Door designee for the state of Missouri. So just a little bit about Missouri No Wrong Door. Its goal is to transform the way people access services in the community. So it is to support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. So the No Wrong Door governance grant that we had, if any of you have been on our stakeholders meetings, the governance grant itself has ended, but we are continuing the work for No Wrong Door in partnership with the Department of Health and Senior Services. They are going to kind of take lead on that, but a lot of work has been done in the background, having lots of meetings to make sure that the systems are working collaboratively and that everyone knows where to make referrals to help the services and systems be easier for individuals looking for services, a little bit easier to navigate. So for opening doors to integrated supports, we focus on the 5 types of services and supports. These services and supports are meant to be integrated in a person's life. That way, they're not solely relying on eligibility specific benefits. It can sometimes unintentionally seclude a person from the family or community that they want to be a part of. So we want to make sure that we're diversifying the services and supports that we're using. That way, a person is able to be included in the family and community that they would like to be a part of. So really briefly, those services and supports are personal strengths and assets. So that's things that somebody is good at, things that other people like about them, personal belongings or resources, relationships, which is family, friends, acquaintances, neighbors, anybody that's able to give you a hand. Eligibility specific is what we talk about in this benefit series. Those are going to be your formal needs-based services that have some form of eligibility requirement, whether it's age, geography, income level, a specific disability diagnosis. Community-based are things in the community that anybody has access to. So that's businesses, parks, schools, groups or membership organizations. And then we also have the Missouri Open Door Technology Series, which is on personal technology, assistive technology, environmental technology. So for the benefit series for the year, we won't be having one in December. We will be back in January though. And those are still going to be the second Wednesday of every month from 12:30 to 1:30. And then the technology series is the fourth Wednesday of every month from 12:30 to 1:30. We moved that up a week for November. So we're not the day before Thanksgiving. So that's going to be on November 20th, and that's going to be emergency alert devices. And then one more quick announcement is that Charting the Life course has their announcements out for Showcase 2025. That's going to be April 29th through May 1st. Registration is now open. Early bird registration is available until December 31st, and then regular registration starts up January 1st. Call for presenters is also out. If you'd like to submit for a session, that's open until November 22nd. And then call for sponsors is out as well. I did just drop the link in there for the Showcase 2025 page, which has all of this information on it with the registration links and everything. If you haven't been to Showcase before, it's a really great opportunity. If you're familiar with Charting the Life course, to get to network and hear from other organizations or individuals who use Charting the Life course in their life or in their profession. And it's a really cool opportunity. And with that, I am going to go ahead and pass it over to Kristen.
Good afternoon, everyone. My name is Kristen Davis, and I am a senior program specialist with the Bureau of Senior Programs. And just to take a moment to kind of explain the hierarchy of the State Department, if you're not familiar, we are the Department of Health and Senior Services, and that covers a wide breadth of different types of programming. The particular division I am in is the Division of Senior and Disability Services. And then under that, you might recognize programs like Adult Protective Services or Home and Community-Based Services or the Show Me Home program. And then also the Bureau of Senior Programs is part of that division as well. My bureau chief is Mindy Ulstad, and she is very active and is the contact at the end of this slide deck. Go ahead and forward, please. Okay, so let's get started. We're here to talk about the Older Americans Act programs. And it's a set of programs that is federal law. Older Americans Act was part of Lyndon B. Johnson's War on Poverty, and the law was passed in 1965. This particular law is focused on keeping the older Americans, 60 or older typically, providing for their well-being and providing programs and services designed to meet their needs. Most of the Older American Act funding goes through the Administration on Community Living, or ACL, and then that's passed on to the states and territories. So in Missouri, the Division of Senior and Disability Services is designated as Missouri's state unit on aging, and we're the pass-through agency for that funding. And we contract with the 10 area agencies on aging in the state to provide those programs and services to meet the needs of older adults within their local areas. Next slide, please. So here we have a map showing the area agencies on aging. The 10 agencies cover the entire state, all 114 counties and the city of St. Louis. So these were established with the Older Americans Act, and in 1973 or 74. They just had their 50th anniversary. The area agencies on aging were brought into existence as part of that act. And we have this map here, and you can find that map at the link at the bottom of the slide that Angelina will share afterwards. Next slide. While each AAA provides services that are unique to their population in their region, there are a set of core services that all the AAAs provide, and that deals with nutrition, information and assistance, some supportive services, that long-term care ombudsman program, and transportation. And we'll go into each of these a little bit more momentarily. So for nutrition, probably the one you're most familiar with are the congregate meals and home delivered meals. Congregate meals are those meals that are served in perhaps a senior center, or the AAAs also have locations where people meet. That could be local community centers or libraries. Um, and then we also have home delivered meals, and depending on where you're at, some people refer to these as Meals on Wheels. And those are meals that are delivered to folks that are homebound or have another specific reason that they're unable to leave their home. And also across the state, not in every AAA area, but there are some areas that have carry-out meals where someone can come in and, due to reasons that they're not able to stay and eat in the congregate setting, they can just pick up their meal and take it with them. And some of those situations might be the individual is a caregiver and really doesn't feel comfortable leaving the person that they're caring for unattended, or it may be due to a medical condition or social reason that being in a congregate setting just isn't very conducive to their situation. Eligibility for nutrition services is 60 plus, and in certain situations, it could be someone 18 to 59 with a disability. And then also, if someone who is eligible, who's 60 plus, comes, they can bring their spouse, even if their spouse is not 60 yet. As far as receiving services, in all of these slides, there will be an 800 number. That is our senior resource line. And the senior resource line is statewide. You can dial that anywhere, and it'll ask you to enter your zip code. And once you do, it will connect you to your local area agency on aging. So that's really how to access any of these services. Next. In addition to nutrition, all of the AAAs provide supportive services, and these are really services that are designed to help someone be able to stay in their home and be safe, healthy, and independent. Um, the services that are available include transportation to be able to get to and from where you need to go. A lot of times that is viewed as medical appointments, but a lot of the AAAs offer transportation for other reasons as well. Errands around town, grocery shopping, trips to the bank, things like that, or to senior center activities. Also, they provide in-home services, and that can range from personal care, like help with bathing and dressing, to chores, homemaker type things, doing the dishes and preparing meals, and even some chore type things like changing light bulbs and flipping mattresses, those sorts of tasks. Um, Also, many of the AAAs provide home modifications where if, in order to be able to stay in the home, the individual might need some modifications to their home to make it safer for them. Big things include adding ramps to be able to get into the home, widening doorways, or kitchen or shower modifications to help that person continue to stay in their home. And again, eligibility for these programs is 60 plus. Next. We also have evidence-based programs, and sometimes you might hear these referred to as 3D programs, and that becomes because it comes from Title 3D in the Older Americans Act. And these are evidence-based programs that can help individuals with a wide range of issues. It could be chronic pain or falls prevention or nutrition awareness. Chronic disease management, any of those kinds of things. And each AAA offers some evidence-based programming. It kind of depends on the AAA what is available at any given point. Most of these programs have a duration of, say, 6 to 12 weeks. So you might be waiting for a program to start a cycle. So those are all things that you can check with your AAA on and see what is available and when. Next, please. Family caregiver services. These are services specifically for caregivers to help prevent burnout and allow them to take care of themselves so that they can provide for the loved one that they're caring for. We have three or four different categories of eligibility for caregiver services, and this is kind of different from our other programs. So you can be eligible for caregiver services if you are an adult caring for someone that is over 60, or you are a caregiver that is older, 55 or older, and you're caring for someone that is for a relative that's under 18. This would be like grandparents taking, raising grandchildren, that sort of thing. If you are 18 or over and you're caring for any aged adult that has dementia, or if you are an older adult caring for an adult child with disabilities. So we offer a wide variety of services. And again, these services vary from AAA to AAA. Um, all of them provide respite services. So that allows the caregiver to have someone come in or take their loved one to an adult daycare facility or something like that so they can have a break. Um, Also, there are a number of supplemental services available to caregivers that those span from um, provision of incontinence supplies or durable medical equipment that allow them to provide better care to the person that they're caring for, to legal advice or um, if someone comes and has a need for an interpreter, they speak a different language, the AAA can provide interpreter services so that that caregiver can help themselves help the person that they're caring for. Also, there's care management opportunities, opportunities for counseling, and also support groups. So again, if you need any of these services, you can contact the Senior Resource Line shown there at the bottom. It's 1-800-235-5503. Next. And then we have the Senior Community Service Employment Program, which we call CSIP, and that is also part of Older Americans Act. Unlike the other programs, this program is funded through the Department of Labor, and they also provide grants to all 50 states and then the territories. The Senior Disability Services is designated as the CSIP entity for the state of Missouri. So we do not do that program first person. We contract out to AARP, who serves Jackson County and the surrounding Kansas City metro area in the surrounding 5 counties. And then we also contract with MERS Goodwill, who has the St. Louis area and then several additional counties on the eastern side of the state. For the CSIP program, the individual needs to be 55 or older, currently unemployed, and their income cannot exceed 125% of the federal poverty level. Next. CSIP is a training program, and it is a subsidized training program. So the CSIP funds that Missouri receives pays for individuals to go out into their community to work at or to train at a nonprofit or governmental agency to learn new skills that help them become employable in the unsubsidized market. So the individuals that are in CSIP work with a case manager and identify, what job they would like to get and what skills are necessary to attain that position. And then they are paired with that not-for-profit organization and work with the people who are at the nonprofit to get those skills. They typically work for around 20 hours a week, and they are paid whatever the highest minimum wage is for that area. So in Missouri, that would be our state minimum wage. The program also, in addition to offering job training, also offers supportive services to help those people reach their goals. So if they need a specific certification, like if they're interested in working in the food industry and they need the ServSafe training, or if they need a specific type of wardrobe, if they're in in-home care and need scrubs, or say closed-toed shoes, something, whatever it takes to help them be successful. Also, the program offers transportation options to help them get from their home to their training assignment. And really, this is beneficial for both parties. The entities that are host agencies have the ability to kind of expand their services because they have more manpower to do that. And then the participant benefits because they're getting additional training that they wouldn't otherwise have access to. Next, please. So as I mentioned, it's available across the country. The Department of Labor tells us how many positions there are going to be in each county, and they base that based on the number of people over 55 who are unemployed and the number of people over 55 and those that are unemployed. So it's kind of a population density sort of thing. So at this time, and this changes yearly, at this time, that there are 8 counties across the northern border that do not have positions this year. And, like I said, annually that changes, and it's all based on population. And like I mentioned that the state holds positions in around Kansas City and then the eastern side, St. Louis and south there. But there are also national grantees. And those national grantees are AARP, Goodwill International, and the National Caucus for Black Aging. And it happens that the National Caucus for Black Aging subcontracts out to AARP. So there is a map there, and as soon as I have an opportunity, I'll drop a link in the chat here that has the contact information for all those individuals. So that is the bulk of our federally funded programs. We have one more coming up, but we'll work on state funded programs. So these are programs that are outside of Older Americans Act that our office maintains. We have a customized in-home caregiver training and relief program. It is called the Missouri Caregiver Program and is run by Community Asset Builders. And the purpose of that program is to work with caregivers that specifically are caring for individuals with Alzheimer's or related dementias. And there are 3 different tracks to that program. There's a training track, a respite track, and then an assistive technology track. And so individuals that are receiving or are connected with this program, receiving services, can get training about the progression of Alzheimer's, some self-care training, and different things of that nature. There's also the respite option, which is very similar to what the AAAs provide. Supplemental products could be incontinence products or nutrition supplements, things like that. And then the newest track is the assistive technology track, which provides funds to help people put technology in their home to help the individual who has Alzheimer's be as independent as possible, and also assist the caregivers in peace of mind for the safety of the individual they're caring for. So it could be things like cameras or door alarms to make sure if there is an elopement issue. It could be medication timers or, boxes that are locked so that someone doesn't inadvertently over-medicate themselves. Any kind of assistive technology. And each family that is involved in this program receives a personal assessment to see what kind of things that they need, and then services are provided accordingly. We also have a naturalization program, and this is specifically for individuals who are 60 or older who have lived in the state of Missouri for at least 5 years and are not citizens. And they must have some sort of barrier that has prevented them from being able to attain citizenship in the regular citizenship path to attend classes and such. So we contract with Monarch in St. Louis, and they provide statewide services to individuals and those who are in the program work with a caseworker. Classes might be provided in a different language, or lawyers might, in certain situations where someone's health really prevents them from being able to attend classes at all, they have lawyers to work to attain a waiver for those individuals so that they can achieve citizenship. We also have senior independent living programs called SILPs. And in order to be in this program, you must be 60 or older and you must reside in a specific area. Next, please. So for that senior independent living program, the goal is to support older adults and keep them safe in their homes. These are regional in nature. The legislature funds these programs and also designates the locations. So there are 2 SILPs in St. Louis. There are 2 in Columbia, which is in Boone County, and then there is 1 in Jackson County. And the people who are living within the boundaries that are designated by the legislature and are enrolled in the program can receive services and attend programs to assist them in staying in their homes. Excuse me. And some of you may be familiar with this program. Prior to being called SILPs, they were called NORCs, which was naturally occurring retirement communities. So the SILPs are the same thing if you're familiar with NORCs. We also have the Give 5 program, and the Give 5 program is a volunteer program. It takes retirees or soon to be retirees and introduces them to the community nonprofits in their area. Basically, they like climb on a bus and go, kind of road tripping around their area to different not-for-profit organizations to learn about the mission and what those nonprofits do. And that gives the individual, an opportunity to see what's available in their community and see where they really connect and where they would like to volunteer or give their time. Next. We have the meal infrastructure program. Actually, funding. This was specific funding that the legislature appropriated. It was $15.1 million, and it was given to the AAAs with the purpose of strengthening their meal infrastructure. And the reason this came about was because during COVID, it was discovered that there were several vulnerabilities within the nutrition system. When, at the height of COVID, when everything shut down, the AAAs really had to be creative and try to figure out how they were going to ensure that our older adults did not have any kind of lapse in their meal delivery. So once some of that came to light and the legislature appropriated this funding to put the steps into place to make sure that that was no longer going to be a problem. The AAAs have used this funding for a number of things, anything from purchasing buildings that can serve as um, meal production facilities to repacking facilities to buying large freezers to hold the food that they have, vans to be able to transport food to rural areas, and all sorts of things like that. There's also the Senior Services Growth and Development Funding. This is funding that was lobbied for by the AAAs, and it had passed, and the amount changes annually. It is based on a percentage of insurance sales, and the funds that go to the AAAs, half of that amount has to go to specifically to senior centers to support them. And then the other half can be used for anything that the AAA needs um, within its planning and service area. So we are in, I believe, the second year of that. And there have been a lot of positive changes and uses for that money, and they look forward to that, having that funding in the future. Next, please. Okay, so this was the federal program that I mentioned that we hadn't got to. It is outside of Older Americans Act, and Angelina mentioned this earlier. This is MIPA, Medicare Improvement for Patients and Providers Act. The um, Division of Senior and Disability Services is the MIPA 2 designee. So we get MIPA money for the Area Agencies on Aging. And what that does is it helps pay for outreach to locate Medicare recipients that qualify for Medicare savings programs and low income subsidy to help pay for their Medicare prescription coverage. So ultimately, what the purpose of this is to try to locate those people who could really benefit by entering these money save or cost savings programs. The AAAs provide unbiased Medicare counseling, and it is free. And they can pick their Medicare and Part D plans. At this time, we have 8 of the 10 AAAs that participate in MIPA. The area around Kansas City, which is MARC, and the area that is Metro St. Louis, Aging Ahead, they do not participate at this time, but the 4 AAAs that border those areas step in to provide outreach and planning and beneficiary assistance as needed for those areas. Next slide, please. So here's the MIPA service area, and basically it looks like the AAA map other than those areas around St. Louis and Kansas City, and just the bordering AAAs cover those areas to make sure that we do have statewide coverage. And then there is also a link to that map as well. Next slide. And then we have the Master Plan on Aging, which is kind of one of those other duties as assigned that we're really excited to have. As we know, Missouri is aging. Actually, the whole nation is aging. But by 2034, Missouri's seniors, those that are 60 and older, will outnumber those who are under 18. So that's in 10 years. And the Missouri seniors will make up 25% of the population. And then as time goes on, by 2060, that gap will significantly widen. And knowing that, the governor signed Executive Order 2301, which enacted the Missourians Aging with Dignity program. And part of that was to develop a master plan on aging. And the Master Plan on Aging is a 10-year forward-facing framework for what is best practice and what needs to happen to make sure that Missourians have the programs and supports in place to age with dignity. Next slide. There is a Master Plan on Aging website, and part of that are all the information, the meetings, all of the notes, and all of that. But we've also really built that website out to include county aging profiles. You can go on there and check out your county and see the number of folks over 65 that reside there, and then specific facts about them, like how many are working, how many have had falls, how many are without a car. All just some really interesting facts about aging in specific counties. And then there's also a statewide county aging profile as well. As part of the master plan in spring of 24, we went out and did a town hall tour. There were 10 town halls, which was one in each AAA region, and then also 2 virtual town halls. As part of that, we sat down with over 1,500 people in person and then another 250 or so virtually to talk about what needs they saw and what needs they had currently, how they saw their future for the next 10 years, what ideas they had as far as how to, how they needed to age and what we could do. And we took all of those comments into account. Those are available on the website. In June or this summer, July and August, we did a statewide needs assessment, and it is the first needs assessment of this scale since I believe the date was 2010. And it was a rather lengthy survey. We got over 7,600 responses on that survey, and the results of that survey can be found on the website as well. Right now, it's kind of an overview and then also broken down by AAA. And we hope in the next um, few weeks, I think by the second week of December, I heard, there will be the information will be broken down by county. So you can see how older adults, adults with disabilities, and caregivers responded to a variety of questions on the county, the AAA, and the state level. So that is accessible using that QR code, but also when you get the slide deck, the link will take you there as well. Next slide, please. And all of this information that I have shared can be found in the Bureau of Senior Programs Programs and Services directory. We have contact information and maps and interactive an interactive map to find locations of senior centers and all of that sort of thing. It can be found either by the link that will be on this slide or the QR code. And we are in the process of updating for fiscal year 25, but the location will stay the same. So you can still use this to access the newest version when it comes up. Okay, next. And that is all I have. Does anybody have any questions?
As I mentioned earlier, the Q&A is open. You can either drop your questions in there, or you can go ahead and raise your hand and I can unmute you if you would prefer to ask that way, whatever is preferred.
And I did have a couple things linked to share. I'll go ahead and drop that master plan on aging webpage in there. And then also there is a link to the National Council on Aging's evidence-based programs. So you can kind of take a look at what is available as far as evidence-based programming.
Okay, well, we're waiting to see if any questions come in. I will just go ahead and say that I dropped the link in there for where to watch previous open door workshops. The recording for this one should be ready in about a week. It'll get sent out to your email if you're on the listserv, and then be on that YouTube channel as well. And we look forward to seeing everybody at the technology one next week if you're able to join. Let's see.
Okay, we do have a couple questions about income or Medicaid. Older Americans Act programs are not income-based. For each service, there is a suggested donation, that lets people know what the cost of that service is, but that is just an opportunity to contribute if the individual wants to. So no one is turned away based on ability to pay, and having Medicaid is not a requirement. The only one that is income based is the CSIP program, because for that program, your income cannot exceed 125% of the federal poverty level. Although there are prioritization for the AAAs, but it is not based on income. It is based on, health needs or greatest social needs. So that sort of thing. Let's see. And then like the specifics are in that programs and services guide. So, if you have further questions about kind of the details of that, those are there. Okay, and seniors can get MSP or HCBS, but not both. The MSP guidelines are on our website. We have a MIPA website that has the new guidelines, so I can grab that for you real quick. And then HCBS, it's connected to Medicaid. So, and then they also have a list of other eligibility based on needs. So that would be something to work with them about. Okay. Here is the MIPA link. And if you go down to the bottom, there is a qualifications link, or it's a PDF that has the income guidelines for the MSPs and the extra help. Okay. How does the abuse and neglect hotline fit into the master plan on aging? One of the subcommittees of the master plan on aging is safety and security. And so our APS fits within that subcommittee. And so it's physical, it's all kind of neglect issues, as well as physical safety as far as environmental safety, and then economic safety and those sorts of things. So there are representatives from the adult neglect and exploitation hotline as well that are part of that and helping guide those efforts. And just to mention too, since you mentioned the master plan on aging, on the website, if you scroll toward the bottom, under other resources, there are year one recommendations. And those were recommendations that were based on stakeholders and scans of current programs and, gaps that we knew about. And then as we have got other information from the town halls and the surveys, those recommendations will be kind of fleshed out a little bit more. But if you're specifically interested on the adult abuse and neglect hotline, or that kind of topic, you can go to those recommendations and see under safety and security where that was addressed and what was being suggested. Okay, so the funding for Jackson County, I believe, is a senior tax levy, and that is at the county level. And how they choose to kind of allocate those funds is up to the county. In I can only speak for some counties that I know about that have this. I do not know how Jackson County is setting theirs up, but there are other counties who take those funds, and there is a senior tax levy board for the county, and organizations or um, kind of initiatives that want to utilize that funding. It's submitted sort of as a um, kind of a grant proposal type situation, where they're presenting their initiative or what they're wanting to fund and asking for a portion of that money. And then based on the needs, those monies are doled out accordingly. So, but that's something to definitely reach out to Jackson County and see what their situation will be and if they'll have specific regulations in place. I believe every senior tax levy has a board, though, so they will probably be in the process of putting that together. Some of the senior services are available for individuals with disabilities, or the AAAs have some programs that fall under that. The AAAs get METAP funding to help with transportation. So those with disabilities 18 to 59 can get transportation using that funding. In certain situations, nutrition falls under that, but the evidence-based programs and in-home services are not. Um, Kind of the caveat would be if there is a caregiver of someone who is an individual who has disabilities, then the caregiver can receive funds to help provide care. Transportation varies across the state. Almost all of the AAAs contract out for transportation. Um, you know, Organizations like Oates or some of the more local transportation. I'm thinking like Scott County Transportation in the Southeast has more of a localized transportation. Um, some of the AAAs contract with On the Go, which is a scheduling hub that deals with Uber and Lyft for more on-demand transportation. Some of the AAAs have consumer directed, where the individual has, say, a neighbor or a relative that can transport them. And so that person who's transporting, the person who needs the ride will pay their ride, the driver, and then the AAA can reimburse. Some of the AAAs have volunteer drivers, so it really varies across the AAAs and kind of what their planning and service area looks like. So you can definitely call that senior resource line to be connected with your AAA and find out exactly what kind of transportation is available in your area. And then also there's always MoRides that you can connect with that has kind of transportation on a broader scale, outside of the AAAs. And I will go ahead and drop the link for the senior resource line in here as well.
Kristen, did you have any more questions coming in on your end?
I don't see any. I think I've addressed everything.
There goes another one. I did realize that it was my bad, but the Q&A actually was not open. It is now open. Um, so if you were trying to get a question in and weren't able to, um, is MoRides for Medicaid recipients only?
No, MoRides is more of a resource hub. You can go in and type in your county, and it will tell you the available transportation that is in your county. So it doesn't limit it to if you have a specific, that you're relying on Medicaid or if you have a specific income. It's just very general. It's just what transportation is available.
Thank you so much, Kristen, for presenting for us today. This was incredibly helpful. And we look forward to seeing you all next time, and thank you for joining us today.
Thanks, Angelina. Thanks everyone for coming.